My name is Peggy Huddleston. I'm Program Specialist at the Missouri Department of Health and Senior Services with the Time Critical Diagnosis Unit. Part of my job at the department is maintain the registries for trauma, stroke, and STEMI. Also to make sure that the trauma registrars and the hospitals are able to access the EMS run sheets and make sure that all of the ImageTrend products sync up so they basically talk to each other and troubleshoot any problems that may arise. Our team was prompted to research this because the governor at that time in 2020 passed a law that said that motorcycle riders do not need to wear helmets. Being in the trauma business, we noticed that there was an uptick in fatal motorcycle accidents of unhelmeted riders. So we started doing some research and found that there was a significant increase, and if you did survive the crash, there was a significant increase in the amount of money it cost for rehab, long-term care, hospital stays, etc., and the effect it had on families also. So we were able to get all that information together, and then I started working with the Missouri Coalition Group, and they took it a step farther and really got the numbers for the healthcare side of it, how much it actually costs Missourians when there's an injured motorcycle rider or passenger, and how much it actually costs each Missourian. So the data we used for this project, Morgan Anderson, the ImageTrend epidemiologist, had reached out to us and asked if we wanted to do a poster project in 2023, and this is the idea we came up with. And with Morgan's and her team's assistance, we were able to pull the information together and present it at several conferences, and showed it to even the Department of Health and Senior Services to let them know that there has been an uptick, and we shared it with the hospitals also, which they kind of already figured there was an uptick, but we had actual data to show that there was an increase in injuries and fatalities. The way we pulled the data, we pulled it out of ImageTrend Elite, which all the EMS services in Missouri will send their run sheets to the state, and then we can put the filters on there and pull just the information regarding to motorcycle accidents, and that's how we provided the information. That's how we obtained the information. Some of the most striking aspects we found was how much there was an uptick in fatalities and the cost to Missourians if they did survive the accident, and how many were riding unhelmeted. So we also were able to obtain some of the information from the Missouri Highway Patrol, who tracks all that information also, and Missouri Department of Transportation, they track it also, which I was surprised that they did, and so we got some information from them also. Once we got this information together, our team shared it with the hospitals. Morgan took it to a couple of conferences and was able to share it with NSIMSO, and then there was a conference down in New Orleans she shared the poster with, and we also put it on our website at the department so anybody could access the information from our public website. And we did share it in some of our meetings with the trauma hospitals, trauma surgeons, and they were very interested in all of the information. The role that EMS data shares in this is with the Motorcycle Coalition Group. They are looking for a sponsor at the Capitol with a couple of representatives to submit a law to repeal the repeal of the helmet law. So this has had a big impact, and it has gone all the way to the Capitol. So it's a very big impact. So the next steps that we hope to achieve is to get a bill filed, probably in the 2026 legislative session, and then we can track the bill from there. We do have a representative whose husband was involved in an unhelmeted motorcycle accident right after the law was passed, and he now has a traumatic brain injury. So that representative is very interested in filing a bill and sponsoring a bill for us to repeal of the helmet law. The best advice I can give to other EMS agencies and or registrars is the data matters. Even anybody entering the data, whether it's a paramedic or an EMT or a registrar, that data matters. So the takeaways for this project, which was very surprising. We have other states that are looking at this, and to see how Missouri, if we can get the repeal back and have the helmets back on motorcyclists, they are looking at it because they have unhelmeted motorcycles in their states also. So they are kind of looking at us to see how it progresses in Missouri, and several of them have come up and asked me, how do I do this? What's going on? Can you give me some advice? So hopefully we can get the motorcycle helmets back on the motorcyclists. It does save lives. Data does matter. Everybody matters. The paramedics, the EMTs, the registrars, it matters.